morning. My name is Gals Generasi Kaime. I am from BSN 111K and today I am going to conduct a general survey to a client who has been experiencing pain in her lower abdomen. In our pre-introductory phase, the first thing we need to do is to review the client's previous medical history. This is important so that we will have an initial information regarding the patient, which will be useful throughout the assessment. Next is to know the scope of the assessment and prepare the equipments. It is very important to know the scope of the assessment so that we are aware of the limitations of the assessment and prepare the necessary equipments which will be used during the assessment, such as a ballpoint pen and a data sheet. Lastly is to perform hand washing. Performing hand washing will prevent the spread of the germs which will cause any diseases during interaction with the client. In our introductory phase, we have 8 steps. First is to greet the client politely and introduce ourselves. This is to gain participation and cooperation throughout the assessment, which will be really helpful to us. Number 2 is to verify the client's identity. This is to ensure that we have the right person to be assessed. Number 3 is to ask how the client would like to be called. This is to prevent using any nicknames or names that will make the patient very uncomfortable and angry. Number 4 is to explain the purpose of the assessment and the reason why we are taking notes. This is to provide information to the client about the assessment and prevent seeing them from being curious and being alert during the assessment. Number 5 is to assess any potential barrier of communication. This will help us have a smooth flow and prevent any difficulty of communication. Number 6 is to provide the client the opportunity to clarify and ask questions. This is to know that the client understands the situation and this assessment and will have no any concerns. Number 7 is to ensure the client's comfort, privacy, and confidentiality. This is to ensure that the client is at ease and very relaxed during the assessment. Number 8 is to establish rapport with the client. Establishing rapport with the client will be very important so that we will gain her trust and she will not be hesitant in sharing her information. Once we have established rapport with the client, we can now proceed to the working phase. We must use open-ended questions to the client so that he or she has the freedom to express her answers and opinions.
Hi, good morning, ma'am. Please sit. Hey, ma'am. I am Carlos Jenner Music Aime, a nursing student, and you are?
Alma, ma'am.
Alma. Ma'am, Alma, how would you like to be called?
Alma, ma'am. Okay na.
Alma. So, Ma'am Alma, the reason for you in going inside the room is I will conduct a general assessment and I will take all the relevant information for you. Will that be alright, ma'am?
Yes, ma'am.
Can you hear me loudly, ma'am?
Oh, maklaro taman ka, ma'am.
Can you hear me clearly?
Oo, ma'am.
Would you like to close the door for you, ma'am?
Okay, ma'am. Kay murag maulaw ko, ma'am.
Sure, ma'am, no problem. So now, ma'am, do you have any concerns or questions you would like to ask?
Wala na, ma'am. Okay na, ma'am.
So, now that we have established rapport with the client, we can now proceed to elicit the relevant information. The first thing we need to get is the biographic data and the reason of seeking care of the client. This is to know the basic characteristic of the client, especially the age, name, gender, and etc. And also to know why the client is seeking resolution about her problem. Ma'am, what is your name, ma'am?
Alma Russell David.
How old are you, ma'am?
43.
Are you married, ma'am?
Oo, ma'am.
When is your birthday, ma'am?
October 22, 1978.
What is your religion, ma'am Alma?
Catholic.
Catholic. What is your phone number, ma'am, if you have?
0950 38 73104.
So, ma'am, what is the main reason for you for seeking health care?
Kanang sakit jud ako ang puson, ma'am.
Now that we are done with the biographic data and reason for seeking healthcare, we can now proceed with the history of present illness. So, history of present illness will provide us the initial data to analyze the client's health. What triggers the pain or makes it worse, ma'am Alma?
Sakit jud siya kaayo, ma'am.
Can you describe the pain for me, ma'am?
Kanang gitusok-tusok siya, ma'am.
Can you specify which area is painful, ma'am?
Hindi, ma'am. Lapit.
It seems that you are feeling pain in your lower stomach. On a scale of 0 to 10, ma'am, with 0 representing no pain and 10 representing the worst possible pain, how would you rate your pain?
6, ma'am. Kaya di na jud ko matulin sa akong mga trabaho, ma'am.
When did it start?
1 week na, ma'am.
Is the pain constant or does it come and go?
Kanang magbalik-balik din siya, ma'am.
Is it worse at different times of the day? Do you feel pain
Oo,
in
ma'am.
1 hour or yes?
Yes, ma'am.
Now we are going to proceed with the past health history. So, getting the past health history of the client will let us identify if there is a connection of the past health history of the client to her health problems nowadays. So, ma'am, do you have any problem when you were born?
Wala, ma'am.
Do you have childhood illnesses, ma'am?
Wala po, ma'am.
Can you remember the last time when you were immunized?
Yes, ma'am.
When was it, ma'am?
COVID vaccine, ma'am. Atong October.
Have you gone on surgeries?
Wala, ma'am.
Have you been into accident, ma'am?
Wala, ma'am.
Do you have any allergies, ma'am?
Wala po, ma'am.
Now that we're done with the past health history, we can now proceed with the gynecologic and obstetric history. This is to know if there is a problem with the reproductive system of the client. So, ma'am, how many days does your menstruation starts?
After 28 days, ma'am.
How long does it last?
2 weeks, ma'am.
2 weeks. Is your menstruation flow, ma'am, heavy, light, or normal?
Heavy, ma'am.
Heavy. Can you remember your last menstruation period?
Kalimot po ko, ma'am.
Any history of dysmenorrhea?
Oo, ma'am. Kanang taga-dugo dyan ako, ma'am.
Any surgery in your private part, ma'am?
Wala, ma'am.
So now, ma'am, I am going to ask about your pregnancy profile. How many times were you pregnant, ma'am?
3 times, ma'am.
3 times. Any miscarriages or abortions?
Oo, ma'am. Kanina ko nakuhaan.
Living children?
1, ma'am.
1. Now that we are done with our gynecologic and obstetric history, we can now proceed with the family history. Getting the family history of the client will help us know if the client has a higher risk of having a common disease that she has gotten in her family. So, ma'am Alma, did anyone in your family have a long-term health problem like lung disease, heart disease?
Wala, ma'am.
None. Did anyone in your family have any health issues, ma'am, like blood pressure, cholesterol?
Oo, ma'am.
Who was it, ma'am?
Akong bana.
Your husband. So, is your husband illness, ma'am, under control?
Oo, ma'am.
Yes. How is your husband illness treated, ma'am?
Nagpa-check up siya sa center, ma'am, every week.
Now that we are done with the family history, we can now proceed with the psychosocial history. So, psychosocial history help us understand the mental health status of the patient, which we can be able to provide health care. How have you been lately, ma'am? Do you feel sad, down, or lonely?
Yes, ma'am. Very sad.
Very sad. Have you ever thought of hurting yourself whenever you feel lonely, ma'am, or sad?
Dili jud ko nagahimo ingana mo.
It's good to hear, ma'am. Do you intend to share your thoughts or keep it to yourself, ma'am?
Oo, ma'am, sa ako ang friend nga masaligan, ma'am.
How do you solve problems when they come, ma'am?
Pangitaan dyan ako paraan para masulbad, ma'am, ang mga problema.
Okay. So now for the last information that we need to get from the client is her current lifestyle. This teaches us how the client's current lifestyle choices impacts her health outcomes. So ma'am Alma, can you tell me your daily pattern of activity or daily routine?
Kana mamatay nagkabuntag, ma'am, magluto, then maglimpyo.
What do you usually eat, ma'am Alma?
Ma'am, di jud lang ko malikayan mga makakaon ko non-healthy foods, ma'am.
Like what non-healthy foods, ma'am?
Kana junk foods. Then mahilig po ko mag-inom og soft drinks.
Do you eat this unhealthy food every day, ma'am?
Usahay maglataan mo dyan ako siya panagsa, ma'am.
How about the soft drinks, ma'am? Do you drink it every day?
Yes, ma'am. Once, usahay po kaduha.
Who buys and prepares the food you eat, ma'am?
Ako lang, ma'am.
Do you follow any regular exercise plan?
Na wala dyan, ma'am. Tamad dyan ko anak, ma'am.
What do you do when you have free time, ma'am?
Relax lang, ma'am, din. Cellphone.
Can you tell me about your sleeping pattern, ma'am Alma?
Tagdugay dyan ko makatulog, ma'am.
What time do you sleep?
Mga quarter to 12. Midnight.
Do you have trouble falling asleep?
Saan, ma'am? Mata-mata ko, ma'am.
Do you drink coffee, ma'am?
Kanang medyo na, ma'am. Every day.
You really love coffee?
Yes, ma'am.
Have you ever taken medication that not is provided by your healthcare provider, ma'am?
Oo, ma'am. Usahay, ma'am. Kanang maglabad akong ulo.
Do you take vitamins or herbal supplements, ma'am?
Madili dyan ko nagainom anak, ma'am, ay.
Okay. So upon summarizing all your health concern, ma'am, I just want to clarify if all the information is correct. You said that you are feeling pain for almost 1 week and you are feeling pain in your lower stomach.
Yes, ma'am.
And also, you stated that your pain is 6/10. Is that all correct, ma'am?
Yes, ma'am.
Okay. Is there any questions or any clarifications you would like to confirm, ma'am?
Wala na, ma'am.
So now, ma'am, that we are done, you can wait outside and wait for your name to be called for your follow-up test. Would that be alright, ma'am?
Okay, ma'am. Thank you very much.
Salamat, ma'am. Thank you very much.